As a friend as well.
As a friend as well. One.
We work in oral agency.
What I would suggest is that Abbas will immediately after this meeting he will circulate the list.
Okay.
Put your name in front of agency. Maybe you can take a part of that agency because agency is big. You can say that one tehsil or some place, some area, some geographical location. We can do assessment in this area and do it.
Okay.
When we wait for our response because we don't want to duplicate assessment also. You just wait for a response. When we give you a response that okay, this area is located to this particular agency, come up with an assessment on just these 4 columns. Concentrate on this one, on these 4, and give it a double value. And you can put in remarks whether this is for relief or early recovery. I mean, for example, relief the activity will be different. Maybe you are distributing hygiene kit and soap and those type of items in relief, but you will not do probably in early recovery. So to do it, come with a realistic figure. We are not getting to get millions and millions of dollars. But if it is realistic, if you think realistically that $100,000 is enough for this area, put it $100,000. There is a chance that you can get that $100,000 rather than $1 million if you put there.
So the question is, has the whole community consented to this suggestion? Because in FATA, we are going to develop a focus for these areas to identify the needs and propose. Because you are saying it time and again, they put it at the bottom line, the dollar bill. So has the donor community concept is sought?
No. That's why I am saying.
Sir, another question is that what is the plan? What is the plan and what is the time frame that we will be meeting again after we are developing the proposal?
Normally, I mean, I would say that 2 weeks should be the timeline from now. Yes, you want to say?
I just wanted to say that this is quite a good move. The donor has not requested for this, or whoever the donors are, but the idea is for WASH or for the working group or the cluster to have a document that they can defend and say this is the situation for the IDPs that are scattered all over FATA, some into Kepi, and we think with this forum we can address the needs with this amount of money. There's so many things happening in Pakistan, so donors are focusing on several other things, and such issues kind of slip through the cracks unless they are reminded with very good data and very good justifiable information. And who are better placed to represent us apart from UNICEF, UNDP, and OCHA to tell these donors that however much there's a flood somewhere in Sindh, our IDPs in FATA still need a lot of attention. So it's going to present something. We don't say it's going to be 100%, but there's a high chance that if we did this, then we could still speak for the IDPs who are scattered around FATA.
That's exactly the purpose. So come up with this thing. Even I would say that if there are some very I would say pictures which really show the nature of that problem, that would be very effective. So bring up some pictures also, send it to us. What we will do is that let's say that we make it not 2 weeks but 10 days. So after 2 weeks when we meet, we will have a sort of accumulation of all these assessments, reports with us, and we will discuss, finalize it in a presentation form, and then fix a date with
So
the
it is meant only for the Kurram areas?
So really, don't go for overkill. Just take realistically whatever you can. I mean, take small area. Take one tehsil of FATA, one tehsil of any agency, and do it as assessment. You say that okay, this is the situation of this agency. And be realistic. Many assessments in which they say there is a lot of wash problems in this area. Does this give me any kind of support?
No.
It's a very. What is the wash problem? Come on, say something.
Be specific.
Be specific. And I'm telling you, I mean, look, we have to focus on the real issue. I've seen very generalized statements. I've seen even our colleague here was mentioning that there are problems in the camps in Rani camp. I mean, there would be problems. There is no way that all the problems could be resolved. यार टॉयलेट्स तो खराब तो होंगे, जब उसको इस्तेमाल करेंगे तो खराब तो होंगे. उसका जो है ना वो उसके मेंटेनेंस एंड रिपेयर का पर्पस यही है कि हर जो है ना देखें, if there are 100 toilets in a camp, at any given time 10 toilets will always be dirty and always be in need of repair. It is because it is the process.
Yeah.
You are doing maintenance through a mechanism. So you are doing the 10, then you go for another 10, then for another 10, and then for another 10. When you reach the 91, the first 10 would already be in the need of repair. All these things. So be realistic, come up with realistic figure. Don't go for millions and millions of dollars. If we all together think that even $1 million for all these agencies will solve some sort of problem, that's as present. And we can, what I have done in this assessment which we have done from MESPAC, is that I said that okay, divide the activities and the areas into red alert areas, into yellow areas, and into green areas. Red alert areas are those areas which are in dire need of support. And that may be very less. So you can say the donor that okay, we have a red alert area which is 10% or 15%, which requires $500,000 to support, and if we give this 500,000 intervention, we can bring it to the yellow areas. So you see, even if you can put up the map, and in the map you can say focus that okay, this particular village is in the red zone of wash, as far as wash is concerned. Because the people, they are walking at 5 kilometers distance and they are bringing water from 5 kilometers. So that's why this is red alert. And focus on gender issues, focus on, I mean if the children are going and fetching the water, if the women are going and fetching the water, this still is another complicating, an additional issue in that particular area. So do it like that. These 4 columns, if you want, I can ask Abbas, he will send it to you, these 4 columns, but otherwise, you have only to listen. But just for those purposes, people who are not here around, we can send this message, we will bring in this in the minutes. Let's give it a try. I'm not promising anything, but let's give it a try. We will try to defend it. Yes.
So one of the issues that was discussed earlier in the meeting was coordination at district level. Do we have some sort of mechanism for the same activity in FATA as well, or
No.
should we establish some sort of mechanism?
One thing is we don't have, and secondly, it's very difficult.
It's not possible.
In FATA, it's not possible.
You have heard our colleague that ACF is still
So what
waiting
is
for
the
its
reason that it
NOC.
is not possible? That we do
Security
want to-
situation of the
No, no.
agency.
Basically, when we are
If
talking
it
about the
is
coordination,
at water
coordination
level,
at government level, and like we as an implementing partner,
Problem is that coordination is normally required when you have a lot of actors working in the same place. Okay, like for example, when you are talking about Charsada and Nashera, there are many partners who are working in the same area.
To avoid duplication.
Here we are even requesting for one partner to go into.
no, but that's not the.
This is the coordination point. In the agencies it's very difficult. In the agencies, finding a place, asking the organization to go there and coordinate, it's very difficult. Particularly for international organizations.
My point was basically the political administration is in the picture of the situation. They know a lot about the ground situation in the area. So at least what we can do that we can share the information with them.
But that's why we are requesting organizations who are present here. That they should talk to the political administration and the local level government line agencies.
Because I believe there is a possibility of duplication of activity. We have personally experienced it for example,
But you can do it. Personally, I would say that it would be very difficult. For example, let's take an example. If you call a meeting inside our agency, how many organizations do you think would be present? 3, 4, 5?
To say
Not more than that. And go for South Waziristan agency, 1.
or
So my point is that this is the forum. What you do is that if you are doing assessment in for agency, discuss it with the public health engineering department in our agency and the other department.
the role of cluster is clear, I understand that, but when we look at it from the donor point of view, that would basically be the involvement of political administration.
I would say yes and no. When we have a PhD representative here, he had been working in various FATA agencies himself, and he has all the information from the agencies he has collected as far as drinking water is concerned. I have been in consultation with Mr. Peshawar. So we would be discussing all the assessments with him. It would be better if you can discuss it at the field level and bring it here. But even I know that political administration, yes, they are, but they are not in the sense that they are not focused on water and sanitation and hygiene.
because there is everywhere.
अगर आप PA से पूछेंगे तो सबसे बड़ा मसला टेंट का होगा, दूसरे नंबर खाने का होगा, तीसरे नंबर पे हेल्थ आएगा.
General, it's not just.
He can give you
wash.
general, yes. But wash, but this one is for wash.
I completely.
When we go to the donors, we will talk about washing.
May I add one thing? Like when we are talking coordination in FATA and inside FATA. There are two activities going on in parallel. Number one is emergency relief activities in camps or in host areas, wherever it is. And number second, it's early recovery activities in very few areas. Regarding camps, there are CCM meetings, camp coordination and camp management meetings held on regular basis, on weekly basis, where the FDMA, where the political authorities, where all the major stakeholders along with the IDPs who are working inside the camp, they are participating and all the issues are resolved in there or even at the provincial level and the CCM. Apart from the camp, there are very few organizations who are currently working in FATA and early recovery areas or in host areas, and I think very few are participating at this forum. It would be, like as Jamal mentioned, it would be good that if anybody is working in early recovery areas or in host communities should be participating there rather than going at the agency level, because there are very few actors and the government or the concerned or particular agency or the NGO can bilaterally sit with the government then.
And I'm telling you, if we present this finding of this assessment as a group, as an endorsement of this group, it will have a lot of weightage. Instead of us individually going to the donors on, if we say that okay, this is an assessment which was carried out by this agency, this agency, this agency, and these are the overall results, and this we are presenting as a group, then believe me, it will have an impact, because it will have an endorsement of all of us. He has this information about the dengue fever, so probably if you feel that we should further discuss it, otherwise we skip this.
One of the issues, a question that came to my mind when one of our colleagues was sharing that information about the dengue fever was like this much cases have been identified in KP and this and that. The only thing that he needs to add to these figures is that people who are affected from dengue are they coming from Punjab, because what we have read in the newspaper that most of the cases that have been identified, people who are coming from Punjab, they are having this dengue fever. So
That's a good question. I think maybe that is possible that these people are coming from Punjab, but Amir is sitting here. I thought he was gone. I was trying to reply on his behalf. Yes, Amir. Do you have any information?
It varies from case to case. Like it's different for every case. It has its own history. Depends. So we have details of all these.
Big problem about Pakistan. There should have been an expert who understands the real causative factors of dengue fever. That would be more a pragmatic approach.
You go to the history of the dengue, how it came to Pakistan.
Sir, to cut you short, sir, we are not concerned with the history. We are basically concerned with causative factor, the factors behind the dengue fever. So
Factors
we have
mosquito.
a
Factors
very
are like
for that.
one of the documents I have already shared, and I may share with you in the detail that how does it spread, like the dengue mosquito, and where does this mosquito lives? There in cool areas, in shaded areas, and it is because of the female mosquito that lay eggs, and in around the homes, schools, and other areas, towns and villages. And when you go to the details, in barrels, in drums, in jars, pots, buckets, flower vases, plants, tanks, discarded bottles, tins, tires, water coolers, the standing water in these different items I am mentioning, they breed in these areas. And it's a biting time is like in the dusk and the dawn time, like when the sun sets and the sunrise, it comes out for food, and it like bites. Just the
What is more important to discuss now after that, to have an integrated approach for its prevention, sir. Because only net insecticide, pesticide, and the likewise would not be enough to prevent.
Talking
because
on
it is assuming a very dangerous proportion, sir.
talking on the preventive measures, like
Should have been a mechanism at this level.
Yeah, he rightly pointed out. I think government must be the front.
What-
He is very lukewarm response presently displaying, and they should take the lead.
WHO in correspondence with the health,
That's
because
what
it's
we are
like
very
a
late.
secondary issue with the WASH department. What WASH can do is like what we are already doing in the hygiene promotion. We can put the preventive measures within our health promotion campaign, but also we are dealing it within the health cluster. That is the like government has been provided a lot of funding regarding the sprays and mosquito control measures, and bed nets have been provided to each district. Around about 1,000 bed nets to each district have been provided by WHO, and 4,000 bed nets have been provided by UNICEF to each district.
I think, I mean,
Like
the issue is that it's, I mean, not saying that it's not important, but it is, of course, it's a health issue,
yeah.
mainly. Because if it was a sanitation issue, it would have been because of standing dirty water. It's mainly a health issue.
Both, mainly the health issue. Wash is also like both the departments are dealing with it.
It's very important. We can convey the message from this platform.
No, we don't need you to
That's
convey
why
it over.
that's why we are keeping it on the agenda.
We are keeping it in the agenda because it is related to water, drinking water, and it is to an extent related to sanitation also. But
We on the part of WASH cluster can do the awareness campaign.
Yeah,
That's-
what
that's-
I want to say.
That's it,
That
what
WASH
our
cluster can do.
The
Like,
rest,
WASH
this,
cluster-
let's depend upon the health cluster.
That this is what like the TMAs that are doing the spray and the other things, but what the organizations are doing, because I know most of the organizations working in WASH, they don't have
Yeah.
this capacity to do the residual spraying or fumigation or other things, but they are already doing hygiene promotion campaigns in different areas, so they can incorporate these prevention messages to their hygiene promotion campaigns, and they can work. Because one of the report I was reading in one of the newspapers, that it can be controlled with the fumigation or spray on 15%. Others are the prevention measures that have been
full sleeves and mosquito repellent.
full sleeves, mosquito repellent, bed nets, like the other prevention, not keeping the standing water in the plants and other things. So these are the prevention measures which can help a lot to the people, and which we can disseminate these messages to the community through our hygiene promotion.
Good, I think that's good, and we will definitely bring in our minutes, and we will even send it to the health cluster as far as all clusters concerned. We can incorporate it in our hygiene message. Okay, we can move on to agenda item number 4, which was ER assessment. I think we discussed that, and that was the purpose. And hopefully, I'm hoping that all of the agencies would respond in a way that is supportive. Finally, A.O.B. Anything you want to mention?
Once again, maybe some of the participants are new to this press meeting. The Global Hand Washing Day will be observed on 15th of October. Will be starting on 15th of October and would last for 1 week. If any organization is working inside FATA in any agency and requires support in terms of supplies, we can, UNICEF as a leading agency for this Global Hand Washing Day, we can support up to our maximum extent, and please share us with us your plans and activities, events, whatever you are going to plan. But as soon as you share it with us, then we would be able to coordinate all these activities.
So the message is that Global Hand Washing Day is on 15th of October. It will last for 1 week. If you have planned any activities and if you are needing support of some supplies, contact us.
Support needs to be planned.
I mean supplies.
Supplies.
साबुन चाहिए, जिनको चाहिए, सब चाहिए, ठीक है? Anything else on A.O.B? Okay, thank you very much. We will be meeting inshallah after 2 weeks. But this assessment, we will hope that we will be having before that. Thank you very much, and see you inshallah.